lot of us don't like going to the dentist. Dr. Gray's sitting right here. Not you, Dr. Gray, but all the other dentists. But when you've been in a traumatic accident and you've suffered injuries to your face or teeth, you better hope to have your dentist on speed dial. Dr. Jeff Gray from Sedation Dentistry, Cosmetic and Sedation Dentistry is here along with his patient Lonnie Easter this morning. Gentlemen, thank you so much for coming in. We certainly appreciate it.
Thank you.
Okay, Lonnie, I'm just going to start with you this morning. You were in a traumatic accident.
Yes, I was.
What happened?
Well, it was June of 2010, the day after Father's Day. I was going to lunch, and I recall I told one of my coworkers I'd be back from lunch, and the next thing I remember was 2 weeks later.
Wow. You were on your motorcycle?
Yes. I walked and rode through an intersection, through a green light, and a truck ran 2 red lights to hit me. Put me in a coma, shattered my pelvis, my leg, arm, 3 different locations in my jaw, and a lot of internal bleeding.
A lot of internal bleeding. And you said you died 4 times?
4 different times, yes.
They brought you back 4 times?
Yes, it did.
Lonnie, you are lucky to be here, my friend.
I am very lucky to be here.
Yeah, you are a blessed man. Let's talk about the injuries to your face, though, for a moment. You said you broke your jaw in 3 different locations,
yes,
teeth that were shattered. I think we have some pictures even to show folks at home what you were dealing with. Obviously, they had to do some major reconstructive surgery here on you. And that's where Dr. Jeff Gray comes in. Dr. Gray, when he came to you, what was going on?
Well, Heather, it's, you know, it was pretty amazing because he was hit so hard that even, you know, with his helmet and things, the jaw just like slammed together and teeth just shattered everywhere because of the trauma. And so we were able to, you know, do some pretty complex things with Lonnie and start to get him rebuilt as the you know, the teeth were broken, the, you know, roots were shattered in half. We had to take out teeth, put in implants, and work around all the other things that you can see, you know, could see there where this jaw was, you know, kind of wired back together for him, and you know, it was really a neat thing because Lonnie's just such a great person, and you know, I'm like the last step of his rebuilding his life. And so
rebuilding and recovery. Lonnie, show us your beautiful smile, if you will. I mean, it really is remarkable that you could go through what you've been through, literally almost died multiple times, and now you're here with picture-perfect smile, picture-perfect teeth. What was it like going through the process? I know that the recovery process had to be one thing, but once you got to Dr. Jeff Gray, was it relatively easy?
Well, I need to say that after going through as many surgeries as I did, the last thing I wanted to do was go through yet another painful surgery.
Sure.
And after 25 years in the military, I was a naval officer. Let's just say not all dentists are like Dr. Gray. So, so I was very hesitant to deal with the whole process, but every day I'm looking at a smile I did not enjoy. So on a Saturday, I sent an email to his website, thinking I wouldn't hear a response, and didn't think a lot would come of it. Same day, I get a response back, you know, saying it was Dr. Gray, and I was like, okay, maybe it's automated service, but no, this is actually Dr. Gray responding.
On a Saturday?
On a Saturday, which he did not have to do. He wasn't working, the office is closed, and he had a ton of empathy for me, and he moved things around to bring me in on Monday morning, and he reassured me immediately that he could help me. And yeah, if I'm happy with this smile, which I am, it's all about him. It's all Dr. Gray.
Yeah, Dr. Gray, you worked your magic once again.
Yes, because I am not a man who enjoys the pain and surgery, and with him, I don't have any.
Yeah, you were able to get through this. I mean, all the things you went through in the recovery and the surgeries, you finally get to Dr. Jeff Gray, and you're like, this isn't so bad.
I was amazed. I really was, because he assured me that it'd be a very little discomfort, and he actually undersold it, because the next day I was able to go to work. The next day I felt fine, and you're aware you had surgery, but you're not in pain.
Not in pain, and
that's the key.
And I think you want to just sort of remind our viewers, Dr. Gray, that the dentist doesn't always have to be a big scary person. I mean, you can go through, I mean, something much less complicated than what our friend over here, Lonnie, had to go through. But it doesn't always have to be a big scary procedure.
Right. I mean, we go from the most simple things, you know, basic everyday things, to, you know, experiences like Lonnie had, and for us, just being of service to people, and, you know, help them restore their health, their comfort, their confidence, and, you know, for some folks even their dignity is really, you know, what we do and what we love to do. Restoring
people's dignity and giving them the smile back like Lonnie has now. Really quick though, just want to let our viewers out there know about Dr. Gray's special. Go visit him. Hey, for $50, I mean, think about that, $50, you're going to get an exam, a consultation, and x-rays for $50, and then you can see that Dr. Gray's big softy, really nice guy, and he's going to go easy on you.
Yeah, absolutely.
All right, Lonnie, thank you so much for coming
Thank
in
you.
and sharing your story. Dr. Gray, thank you for everything
Thanks,
you do.
Heather.
I asked Lonnie, you still ride a motorcycle? And he said he was. And I'm like, oh, your wife isn't mean enough to you.
My wife is the best. She absolutely is.
She's a really understanding woman.
Hi, honey.
All right,
Hi,
up
baby.
next.